Well, welcome to our podcast number 4 with audio this time, hemostasis. Well, hemostasis is a stoppage of bleeding when blood vessels are damaged. And the whole purpose of this is to prevent hemorrhaging, which is a loss of a large amount of blood. The methods utilized in hemostasis are vascular spasms, platelet plug formation, and then actual blood clotting. And this is the formation of fibrin threads which hold the platelet plug in place. Well, the vascular spasm process is fairly simple and straightforward. When there's damage to a blood vessel, pain receptors are stimulated. These pain receptors cause a reflex contraction of smooth muscle of the small blood vessels that are damaged. These blood vessels contract and reduce the blood flow for several hours until other mechanisms can take place in the clotting process. And it only works for small blood vessels. Well, platelet plug formation is the second part of this process. Now make sure you click on the gold word platelet so you can watch the video about how coagulation takes place. Well, platelets store a lot of chemicals in granules that are needed for platelet plug formation. There are two types of granules, alphas and dense. The alpha granules contain the clotting factors and platelet-derived growth factors. The dense granules include ADP, ATP, calcium 2 ions, and serotonin, fibrin-stabilizing factors, and other enzymes that produce final clotting. Platelet plug formation takes place in kind of 3 steps. The first one is once there's damage to a blood vessel, platelets start to adhere to the damaged portion of the blood vessel. When the platelets adhere to the damaged blood vessel, they release substance which begins the aggregation process, which is the addition of more and more platelets until the plug is completed and stops the blood from flowing. Well, the problem is this is a kind of a temporary fix, and we still need to lock that clot in place so it doesn't move. Taking a look at plate adhesion really quickly, this is a couple little pictures here that show you what happens. Step 1 is the platelets stick to the exposed wall of the blood vessel. Second part is that they release a substance that, as a result of that reaction, that causes additional platelets to join the fray and try to stop the blood flow. Other things that are released are serotonin and thromboxane, which are vasoconstrictors, which decrease the blood flow through the injured blood vessel. Last step is platelet aggregation, and these are where the platelets, the activated platelets, all stick together, and they activate continuing additional platelets to form a mass called a platelet plug. Last step is the platelet plugs being enforced by fibrin threads, and that's formed during the clotting process, which we're going to discuss next. Okay, looking at the blood clotting overview. Well, clotting is a cascade of reactions which have to happen in sequence. It seems that one clotting factor activates the next in a fixed sequence that results in the formation of fibrin threads that hold the platelet plug in place. The deal here is that we want to form prothrombinase first. And prothrombinase and calcium 2 ions convert prothrombin into thrombin. Thrombin converts the fibrinogen into fibrin threads. And we're going to see that step-by-step process in a minute. Well, when blood starts leaking from blood vessels, the blood tends to thicken into a gel-like substance. And the gel starts to separate into 2 things, liquids, which we call serum, and that serum is plasma without any of the proteins. The proteins are kind of stripped out. And a clot of insoluble fibers, which is the fibrin, that is the protein, in which cells are trapped and other substances and the platelets are held in place. The substances required for clotting are calcium ions, enzymes which is almost all synthesized by liver cells, and substances that are released by platelets or damaged tissues. Let's take a look at the process. Oh, here's a bloody extra credit problem. You can unscramble these letters to form a 2-word phrase. You'll be receiving 1 point of extra credit on your next test. Good luck. Clotting factors. I listed the clotting factors here. Took them right out of the book for you. Well, when I typed them, I just used Arabic numbers, 1, 2, 3. But the reality is when you see the clotting process, you're going to see the Roman numerals. And we'll see that in a minute. Okay, so here's the clotting cascade. This is a step-by-step process that has to take place in order for blood clotting to occur. The goal at first is to form prothrombinase. That's an enzyme. Of course, an enzyme is a protein. And we can form that by two methods, and oftentimes these methods happen simultaneously. One is the intrinsic pathway, and this is internal to the body, internal to the blood vessel, and the second is the extrinsic pathway, outside the blood vessel. So what we're going to lead to is a final common pathway that produces fibrin threads. So once we get to the stage where prothrombinase is made by either the extrinsic and or the intrinsic, then all the rest of the process is exactly the same. So let's take a look at the extrinsic pathway first. Some sort of tissue trauma, let's say cut. Well, the minute that tissue is damaged, something called the tissue factor, TF, is released. Now, tissue factor is glycoproteins and glycolipids that are embedded into the cell membranes. Well, that tissue factor, in the presence of calcium 2 ions, is going to activate a clotting factor that is traveling around in the blood called factor 10, right, or factor X. Well, once clotting factor X is activated, then again in the presence of calcium 2 and clotting factor 5, they work to create prothrombinase. That's where we stop the extrinsic pathway. We get prothrombinase created. If you look at the intrinsic pathway, blood trauma causes damage to the endothelial cells and exposed collagen fibers, and damages some of the platelets. Well, these platelets wind up being activated in the presence of calcium and the damaged tissue material, and also a clotting factor 12, in the presence of calcium, is activated. Well, the calcium which has activated clotting factor 12 then turns around and activates clotting factor 10. Now, clotting factor 10 then will deal with those activated platelets that are busy trying to form that clot, and those activated platelets will work with factor 10 in the presence of calcium and in the presence of clotting factor 5 to create prothrombinase. Now, the extrinsic pathway begins happening in seconds from the time that the wound occurs. The intrinsic pathway takes a few minutes to really get going and create prothrombinase. Well, once you create prothrombinase, we're going to look at the common pathway. And the goal here is to get those fibrin threads, those stabilizing fibrin threads, in place. Well, I'm going to skip this slide because we've done this one already. And we've done the intrinsic pathway. The common pathway, prothrombinase and calcium 2 ions catalyze the conversion of prothrombin to thrombin. And then thrombin, in the presence of calcium 2, as that is activated, converts soluble fibrinogen to insoluble fibrin threads. Well, this also activates the fibrin stabilizing factor 13. And this activation of 13 starts a positive feedback that accelerates the formation of prothrombinase, which speeds up the whole process of creating more fibrin threads, and it also activates platelets to release additional phospholipids, again speeding up the process. But once the clot is in place, right, after the clot plugs the ruptured blood vessel, platelets on the fibrin threads start causing the clot to retract, to tighten up. These trapped platelets release a factor 13, which stabilizes fibrin threads, and the edges of damaged vessels, the blood vessels, are pulled together. Fibroblasts then and endothelial cells repair the actual blood vessel. Right? All the clot does is stop the bleeding. Underneath that, the fibroblasts and the endothelial cells are creating new cells and filling in to repair the blood vessel. Well, we have a very important vitamin involved in clotting. That's vitamin K, but vitamin K is a fat-soluble vitamin, and it's absorbed if lipids are present, but absorption is really slowed down if the bile release from the liver is insufficient. Well, what vitamin K does is help synthesize 4 of the clotting factors, and those are factors 2, 7, 9, and 10. And these are produced by bacteria in the large intestine. Well, suppose you make this clot and it just keeps getting bigger and bigger. Well, we have a system in our body called the fibrinolytic system, which dissolves small clots at the sites of completed repairs. 2 things happen. Fibrinolysis is the dissolution of the continuing expansion of the clot, and it only stops the part or dissolves the part that is getting too large. Plasminogen is converted into plasmin, that's also known as fibrinolysin, which digests fibrin threads. So no more platelets can be trapped and pulled into the clot. So this whole process is to ensure that clots don't get so large that they actually block the flow of blood in the blood vessel. A couple of anticoagulants when thrombolytic agents are used by doctors in order to suppress or prevent blood clotting. When surgeons are doing any kind of operating, they use heparin, which slows down blood clotting. It would be very difficult to be doing surgery and have the blood clotting while you are trying to work. And warfarin, also known as Coumadin, is an antagonist to vitamin K, so it blocks the synthesis of clotting factors. Warfarin is a lot slower than heparin, and it's typically used on a long-term basis for patients who have low blood pressure and other ailments of the blood that create clots inside the blood. So when vitamin K is blocked, synthesis of the clotting factors cannot occur. Well, how do you deal when you give blood, and we have blood drives at our school all the time, how do you store blood in blood banks? Well, you treat them with citrate phosphate dextrose, which is CPD, and that removes the calcium 2. And if calcium 2 is removed from the blood, there can be no clotting take place. Intravascular clotting is unwanted clots that happen inside a blood vessel that is not damaged. 2 types we're going to look at. One is a thrombosis. This is an unwanted clot that forms in an unbroken blood vessel. Tends to form on the rough inner lining of blood vessels. It occurs when blood flows too slowly and allowing clotting factors to kind of build up in local places and cause coagulation. Sometimes these thromboses dissolve spontaneously, or in other cases they dislodge and they travel until they get stuck in smaller blood vessels. An embolus is an unwanted clot, and these happen, it's either an unwanted clot, an air bubble, or fat that occurs as a result of a broken bone. And the clot, air bubble, or fat travels through the blood. An embolus is named after the location they're found. So, for example, if an embolus winds up in the lung, it would be called a pulmonary embolus. A lot of people take low dosage aspirin, baby aspirin, to reduce inappropriate clot formation. And this is a preventative type of medication. And this reduces the possibility of strokes and TIAs and myocardial infarctions. Okay, that's the end of the presentation for Blood for Hemostasis podcast number 4. If you have any questions, please make sure you ask them in class tomorrow. Please don't forget the extra credit puzzle, 1 point extra credit on your next summative test. You need to have it to me by 5 o'clock Friday. Thanks a bunch.